All right, now to the latest on coronavirus here in Kern. The COVID pandemic has had peaks and valleys, and right now we are still in an upward trend, more like a steep climb, actually. Experts say this winter surge in new COVID infections won't peak until mid-March, the result of holiday travel and exposure to the Omicron variant among people who haven't received a booster shot. 17's Marco Torres has more.
Hospitals from around Kern County are feeling the strain from COVID-19. Some rejecting people from taking the COVID-19 test if they aren't already their patients. The strain on hospitals and clinics is seen across the country, but here at home it can be seen with long waiting lines, out-of-town strike forces, and even rejections from local medical sites for non-patients asking for COVID tests. These rejections happened recently at Bakersfield's Clinica Sierra Vista.
We are in an emergency state. We've had some really huge surges in demand for COVID testing that have far outweighed our capability and what we can provide as an organization.
It isn't just clinics feeling the pressure, it's also large hospitals too.
We started to see the cases with non-COVID coming to our hospital, so we are really very busy in our emergency room, in our OR, in our all our acute care, taking care of these patients. And then the Omicron came and it affected our staffing.
The biggest trouble is when staff get sick. Before, staff couldn't return until after 10 days of isolation and with a negative COVID test. That number has decreased to 5 days with a negative test, but a week without essential workers can drastically affect any operation.
People call in sick, you bring what we call like travelers or temporary staff to fill in, and we have to really onboard them and make sure that we stay vigilant.
As coronavirus cases continue to increase as predicted, we'll be sure to keep track of those numbers as well as the statuses of the hospitals in the county. In Central Bakersfield, Marco Torres, 17 News.
All right, Marco, thank you. Well, here